thank you so much, Kristen,
Absolutely.
for being here with us, because I know you're the best trainer we have in the world. You were my first trainer.
Oh,
back in the days.
Back in the day, we had some fun.
Yeah.
That was in 2014, I think.
Yes, it was 2014 at Dr. Carol's office.
Yes. Yes. Thank you. Thank you.
Thanks. Yeah.
So let's get started. Let's get started. And if anybody else pops on, we'll just let them in. And, you know, so I'd love to get to know you, Monique, and Daniela a little bit more. Tell me where you are in your business. How often are you imaging? Is this a full-time job for you? Start with Monique.
Well, I think every day I have some how do you call them? Making some studies for thermography every day, and some days they are all the hours are filled, and some days it's like 2 or 3.
Sure.
But and every, well, that's not 5 days a week, but I think 3 days a week. And but every day we talk about thermography every day.
Great.
I'm just from the hairdresser and I talk thermography. It's really,
it's like you're hooked. As we say in America, you're hooked. Yeah, that's great. So it sounds like you're a relatively busy thermographer. And great. And you're using the Total Vision system.
Yes.
Good. So we're going to train on that. And the other thing, and Danielle, you'll want to hear this too, is I talked to Dr. Carol today, and Dr. Carol wants to make sure that everybody has received the update for Total Vision. And when you open up Total Vision on the front, before you choose a study, it should say 3.1.1.3. 3.1.1.3.
I do not have it.
Okay, we'll make sure that you get it, because some of the new concepts that we'll be talking about in training, and also the old ones, rely on that system now.
Okay, and then in the old one, perhaps it's new in the new one, the point 3, question 10 is, I cannot read it.
Question 10, okay.
I don't know what it is, but question 10 is like, it's...
Is it all jumbled up or something?
No, only 10. It says 10 and then the dot, and it starts the sentence, but it's only 3 words or something like that. And
did you go to, is that in the breast? The breast questionnaire?
Yes.
So now the breast questionnaire goes 2 pages.
Oh. Okay.
So it will continue on into the next page, quite possibly, or if your screen is magnified a little bit more, it will kick it out and put it onto the next page because your screen is magnified. I don't know. Look for the rest of the question on the next page. See if it's there and let me know.
No, it's not. Because, and I made the system large, so my full screen, but no.
Maybe it's also because you were you're screening in Dutch. Maybe it's the Dutch translation.
Yeah,
it's a Dutch translation. So I think it's some flaw there in the Dutch translation. Yeah.
Okay.
Some questions in the Dutch are still English.
Yeah. Yes.
Okay. All right. I'm just writing this down for Dr. Carol. Okay, gotcha. So Daniela, can you unmute yourself and tell us a little bit about yourself? How often are you imaging?
Sure. Hello, everyone. Nice to meet you.
Hello.
I'm Dr. Daniela Calvillo Mares. I'm the head clinical thermographer at Check Diagnóstico Térmico, a thermography clinic here in Mexico. Good. And we've been working with thermography for about 3 years now. We use FLIR cameras, of course. And we had our first training with a Mexican university, and we know how to take the images and how to interpret them using the software provided by FLIR systems.
So are you not using Dr. Carol's Total Vision? You're using FLIR's?
Yeah.
Yeah, we are using FLIR system. It's a software that let us see the images and interpret them.
Okay, all right. So we're going to be training a lot on Dr. Carroll's total vision system, but that doesn't mean you won't get a lot out of this training. It just means that if you're using the FLIR software, you're not going to see, you might just kind of have to just kind of wait through the times that we're talking about total vision, Dr. Carroll's total vision.
We've seen that it's very similar.
Good.
Software, it's pretty similar, so maybe we can learn a few things.
Yeah, absolutely. Okay, wonderful. So let's talk a little bit about what we're going to do. First of all, do you have any questions basically about what we're expecting from this training? And while you think about that, I'm going to share our brochure here for the training so we can kind of go over it with you.
Mm-hmm.
So let's talk and jump in if you have a question. No worries. So we're going to.
The things we see here, sure. you send it to us?
No,
yes. It's online.
It's online. Yeah. I can send this to you too. Yeah. I'd be happy to. Okay. And maybe right now, just in case you don't have it, you can jot down my email address.
Yeah.
The training at IAMTonline.org comes to me, but so that's down here in the lower right corner here, but also that same email address is Kristin, Kristin, IAMT @gmail.com. So Kristin is Kristin, not an EN like most people like to spell it. My mom liked the 2 dots over my eyes.
I have a daughter which name is Kirsten.
Yes. A lot of people will sometimes pronounce it Kirsten.
Yeah.
But it's KRI. And so IAMT at Gmail. And then this training at IAMTonline.org gets to me, I think.
At gmail.com.
At gmail.com. Right. Okay. Right. So let's talk a little bit about what we're going to be doing here. What we're going to do is we're going to start next Wednesday at 1 o'clock Eastern time and go till about 5. If we get done early, we get done early, but please block that time out, about 4 hours. What we're going to do is we're going to do a review of the basics. First and foremost, what I'm hearing from Dr. Carroll, who I keep in touch with almost daily, is that people aren't just doing the basics anymore. What happens is they come to training, and I 99% of the time I'm the trainer, and they get all this, they do well, and then a couple of months pass, and they kind of, you can either get a little lazy, or you forget things, or you think you're cutting corners and no one will notice. So get rid of something here. So it's important that we get these reviewed and that everybody is on the same page with frame, focus, color, and zoom. These are the basic tenets of high quality professional imaging. It's what separates us from thermographers who just, what we say in America, point and shoot. We use overlays. We use we make sure our focus is good. We make sure that our colors properly depict what the actual body is emitting. And we use our zoom so that we can fit them just right without always having to sound unprofessional moving the client. So what sounds better to you, Monique, when you say, oh, can you move a little closer? No, a little farther. Oh, stop right there. Oh, no, you went too far. Go forward. Or all you do is you click on Zoom. Click, click, click. And you say, all right, we're moving on to the next image. Right? So that's an obvious question with an obvious answer. Some things aren't as obvious, but we're going to be going through all of them. And I have a series of PowerPoint presentations that really help you guys remember the beginning of training and also some of the advanced concepts that come with frame, focus, color, and zoom. One of the most important advanced concepts we're going to talk about is color. Why do you suppose color is really important? Tell me, Daniela, can you unmute yourself and tell me why you think color is important? And I'll give you a little hint. Why is color important with respect to the finished report?
Because it's giving us consistency during the follow-ups with our patients.
Good. Consistency is an excellent answer. It's always a good answer because consistency over time is the reason why we try so hard to image the same way every time, because we want comparison. Francine is an interpreter. Francine, how hard is it for you to interpret when somebody takes the images one way in August and then in October, they take them a little hotter, or they don't fit them in the overlay properly, or maybe they're a little off with focus? How do you do that?
Yes, I need to adjust the colors then first, because otherwise I can't make a good interpretation, a good comparison study.
Right. So you have to fix it.
Yeah, I have to fix it. But the way the thermographer made this study, that's how it will end up in the report as well.
Very good. And I'm really glad you mentioned that.
Yeah.
I'm glad you mentioned that. Monique, so then what happens? So what Francine just said is she said that if you take it in one color intensity, we'll call it intensity, because obviously their color doesn't change, their temperature doesn't change of their actual body. You just make it look more or less intense. So when we take color intensity different on the second study, the interpreting physician can change the color and they can do the interpretation and give you a good interpretation, but the color doesn't stay. That's not the interpreting physician's job, is to go and correct all your color issues, right? And so what ends up being the problem? So the way that you took the image is the way the client sees it. So Monique, with all that said, what ends up being the problem?
I think you have to start with the eyes, the white spots, or
But what ends up being the problem? What is the problem? What is the downfall of having imaging sessions, studies, 3 months apart, and they don't match? They're not properly colored.
You cannot compare. You don't know actually what's the problem.
Good. Daniela, you want to take a stab at giving us more information about that?
Well, you can think that there's a new problem or new patterns that
weren't there before.
Weren't there before, that maybe they're nothing, but in the comparison it's totally different, and you can think about pathology or something else. And actually there's nothing there.
So
yeah, also
excellent answers.
I think also I always think of the point of view of the client.
Good.
If the client has 2 reports, one from August and one from October, and the images are so different in color, they think to themselves, oh my God, something happens, because they have no idea that the intensity is the same. But so you alarm your client.
Right.
For nothing.
For nothing. Yeah.
So the images do not match the interpretation. Now, as thermographers, that's one of the biggest responsibilities we have. The images have to match the interpretation. If the doctor says, the interpreting physician says that we have a significant sinus pattern on the frontal sinuses, and you took them too cold, the client's going to look at that and say, that doesn't look bad. She told me that if I saw red hyperthermia, that it could be bad. Why is the doctor saying I have a significant sinus pattern on my forehead? I don't see anything. So what does that do? That makes us as thermographers and thermography as a whole look unprofessional because we're not matching the interpretation. And color is a way to visually experience temperature. Otherwise, we just do it in black and white and send them their report. In grayscale, send them the report, done. But instead, we go the extra mile to put color on them so people can really visually experience it. So color is going to be one of the big advanced concepts we use. And I'm going to show you some tips and tricks that I think will help you color your images with more proficiency. Okay, we're also going to be talking about framing. And again, when we put the, can you see my little arrow tracing our overlay here?
Yes.
Yes. Yes.
When you put the people in the overlay and you have them match up as best you can. Not everybody has this perfect chin. Not everybody has this perfect posture. But when you strive to fit them every time into the overlay, again, what do you get? Daniela, I think you said it. You get
Consistency.
Consistency. So anytime I ask a question and you don't know the answer, you could throw the word out consistency and probably be right at least half the time. Because it's all about consistency, because really, thermography is all about comparison over time, isn't it? Your first imaging is fine. It's great. You need to have it. But your second imaging, that's powerful. How have you changed? Is that pattern getting better or worse? Or was it just a little fluke that day? These are things that your second and third and fourth images, studies are going to really flush out so that your clients can understand what's going on with them. And the more you can image them professionally and give them reports that really help them make changes, the more trusted and admired you will be. And you will be a professional representative, an elite representative of the world of thermography. And that's what we as IAMT thermographers strive to be. The elite, the professional, the ones that give you the truth. Absolutely. So we're going to be talking about all of that. And we're going to be talking about other just concepts. Some of these are concepts, Daniela, of the software that you may or may not have, and maybe you do. So we're going to make sure that, you know, that we go over some of the tools that Dr. Carol provides for us within the software that may be in other softwares as well, that really help us, again, just be more and more professional. The other thing we're going to do is, and this is basically the FDA here in the United States, but rules tend to be very similar with the GDPR and the FDA of different countries. Just what we can and can't say. We don't want to get in trouble. And we also don't want to over or under represent what thermography can do. So we're going to be talking about those. We're also going to have Dr. Carol come in and talk to us about what interpreting physicians are looking for. And I'll ask Francine too, because she interprets what thermography interpreting physicians are looking for, what kind of mistakes they see most often, and just the value of thermography as a whole in terms of their interpretation. We're going to talk a little bit about the concepts of infrared too. I've contacted Jim Seffrin of the Infraspection Institute, and we are hoping, we're crossing our fingers, as we say, that he can come on board and give us a little demonstration of the concepts of infrared, because that's our next class. After this one, you're eligible to take that class. And we're trying to get that going, and we want to make sure that you guys know how valuable that's going to be. Any questions so far?
No. Well, the difference between Europe and Americas, I think, is that we never do privacy screening. So, you know, so I usually move my stand up and back because I don't want to ask my client a lot of questions, move to the left, move to the right, you know, they just sit on the stool, stick there, and I will do the job because I know how to fit it into the overlay. Yeah. So that's a minor difference. And so I was just wondering, how are we going to do it with the live screening?
Okay. Now I've done a lot of this for the past decade. I've been training in Dr. Carroll's classroom, and that was easy. You came to my classroom and we were right there together for 4 days. When COVID hit last year, we decided to try it over Zoom. It worked great. And long story short, we've been doing it through Zoom ever since, and we're going to continue to do it over Zoom because we have found that it works. Here's how. You're going to have your computer that you image with connected to Zoom. All you have to do is screen share with our group, and we'll all be able to see you practicing. And each one of you is going to get a turn because we want you to do hands-on imaging for the group. Your models that are going to be there for you are going to need to know this, okay? So some models are very brave. They're like, oh, if this is a classroom type situation, I'm happy. You know, other women are like, you've got to be kidding me. So you have to find a model that's willing to let us all, you know, look at her images. But we'll be doing some live imaging with you connecting your computer that you image with to Zoom and screen sharing that. It works great. I do it all the time. Any questions about that?
Yeah.
You mean one at a time. So one student has a model at a time. So another week, someone else.
Exactly. Okay. Exactly. So you would have, go ahead, Monique.
For instance, Francine is having a model, and we all have the computer where we work on, and there we look at the pictures from you.
Right, where we look at Francine doing live imaging.
Yeah. Okay.
And that is a very powerful way to learn. And your models just need to be patient because we're going to be discussing things and talking about things. They also have to be a little bit bulletproof, as we say in the United States, meaning that we may talk about some patterns. We may talk about something. That doesn't mean we're talking about cancer, you know? So I always tell that to the models when I'm teaching. I say, now listen, I may mention a pattern because our thermographers need to be able to spot things like that. They need to be able to make sure the color is right. That doesn't mean when the word pattern only means pattern, it doesn't mean a disease. So they have to be a little bit, they have to understand we're going to be discussing this. Whereas normally when you guys image, you don't talk about that. You image them and you send them home. You don't say, oh, there's a pattern here and there's a pattern here and we're talking about this and that's a little hot and that's a little cold. You don't talk about that when you normally image. So your models need to know we're going to be talking. And that doesn't mean anything bad. It doesn't mean a disease. It just means we're discussing what we're seeing. Important. Does everybody feel okay about that? Does everybody feel that they can get a model to sit down?
But if you want to discuss the patterns, actually, I think you can do it also with a study which is already made.
We can. But in live imaging, we have to bring patterns out with color intensity, with focus. And we're not going to be talking about it all the time. But when we do, we don't want to scare them. One of my first imagings, online Zoom trainings I did, we were talking about, it was a nothing pattern. It was like, you know, nothing.
Thank you.
Oh, here comes lunch. Yummy. So we were just talking about it, and all of a sudden the model just said, hey, Is there something wrong with me? You guys are scaring me. So I realized right then that if I'm not in the classroom with them to talk to them and soothe them, and they don't understand what we're talking about, we need to just remind them. We're just talking about colors that we see and, you know, differences in temperature and things like that. And always, whenever I am working with people like this, if we think that they should get that interpreted, I'll say something to the thermographer, who will mention it to the doctor or whoever's in charge of the clinic, to make sure that if we do see something that looks pretty significant, that they get that interpreted. Mm-hmm. You know, so we always say, we're not going to leave you hanging. If there's something that we think you need to get interpreted, we'll make sure that the doctor is aware of that and that you get that interpreted. We never say that looks scary. We just say, yeah, you might want to get that interpreted by our physicians, you know, and we just keep it very professional. Yeah. So your models just need to know that. And I would say that we'll need your model for about an hour and a half. Mm-hmm. Yep. Okay. So it's not like we're going to make them sit there in their skivvies, as we say, in their birthday suit. Everybody know what birthday suit means? Oh, birthday suit.
Oh, the birthday suit. Okay.
The birthday suit, naked for 3 or 4 hours. We're just going to have them there for about an hour and a half, and we're going to do some live imaging so we can practice live. And there'll be a lot of, sure.
We call it Adam or Eve costume.
Oh, okay. All right. I get it. So we're going to be doing that. And that's going to be the most powerful part of what we do. And you're going to be imaging somebody in front of the class. And we think we're going to have about 5 students or so. And Francine as well. She's going to be taking this as well. And I'm sure that you'll have a lot to add, Francine. So you can always everybody can always jump in. I'm not the end all be all trainer. You guys have been out in the field. You've been learning. You've been growing in your businesses, and you've been researching and studying yourselves. So if something pops up that you say, hey, I do it this way. Wow, we may have all just learned something, right? Mm-hmm. Okay.
That's the nice thing about this training, you know, being around professional tomographers. I mean, this is the first time to be around professional tomographers.
How often do you get to do that? We get together every 2 years.
I love it. Yeah.
And who knows? I mean, right now in the United States, we don't know when COVID's going to stop. And I'm in Florida, which means it's like COVID is knocking on my door right now, you know? So, I mean, we're stuck inside, and it's great to be able to talk to other thermographers, to be with them, and to, you know, just talk back and forth and learn and share, isn't it?
Yeah, lovely. Yeah, fantastic.
Any questions so far?
No, not really. Just that we're going to see if our software allows us to share the images and to see if we can work as well.
Okay. Yes, that'll be important because we want you to do live imaging. We're going to have you do 4 full body studies as part of your evaluation. What have you learned during the class? So this is the last one here. What are you going to learn during the class? And we're going to kind of grade that based on you sending us 4 full body studies. And myself and Dr. Carol will be looking at them and grading them. Now, this one is kind of tough here because this is a United States thing. So we may not get to this. This is one that I wanted people in the United States to do on their own. It would be on their own cost, and that was like $25. And what you do is you go online and you take a very simple class and you read about HIPAA, and you guys have the GDPR, and you learn about, you know, different aspects of that. You take a short quiz. And the thing I realized about this let me see something here. I'll show you. Where is it? It's not here anymore. The thing I learned about this class is that you can't flunk it. Mm-hmm. And the reason why you can't flunk it is because you just keep taking the test until you pass. Oh. So here's my course completion. And basically what I did was I went in and I read all of it's so boring. It's awful to read.
So boring.
Oh, it's boring. But you read it and you get just enough.
Mm-hmm.
You get just enough goes in your head. You go and you take the quiz. And let's say the quiz is 20 questions long. And there's different quizzes along the way. The quiz is 20 questions long. And then it tells you what you got wrong. So then you go, you know what you got wrong. Now you go back and you read those sections. You go back, you take the quiz, you get them all right. So that's how you pass. But this is for United States. And so if you guys have any kind of short, easy course, this was only $25. A short, easy course that you can take that you can get any kind of certification. If you don't already have it, I would suggest you do that, but I'm not going to make it a requirement for this particular class because you guys are out of country. Make sense?
Makes sense. Yeah, but I'm going to look for it. Maybe we have a training here.
I don't know.
AVG training. Huh?
Yeah, it's not hard to do. The one I did, make sure that you pass. And that's what we're going to make sure here too. So you're going to send in your full body studies, right? I'm going to look at them. If I don't feel like you did your best on one of them, I'll let you know and you can redo it.
Okay.
You can redo a different one. So it's not like, nope, you don't pass. Sorry. You know, you're going to pass. We're just going to make sure that you do it right. Okay. So I think this is going to be a good class. We want to really make sure that you are all in attendance for all classes. So these are going to be Wednesdays this month, 11th, 18th, 25th. We may not always end at 5. If we're done at 4:15 and you guys you can't take anymore, you've gotten enough information and you just feel like, okay, we're just going to make sure we get all this into you. Any questions about that?
No. Yeah, 5 p.m. is 11 p.m. here, so that could be a bit late. So
okay, yeah, that is late.
1 p.m. starts at 7 p.m. here.
Okay.
So, but it's just 3 times, you know. Let's go for it.
Yeah, push through.
Push through.
That's right. We will try to. I just wanted this time blocked out. Obviously, you're not going to have another appointment at 11 o'clock at night in Europe.
That's right.
So I just wanted to make sure that if we ran long, that you had that time set aside. Chances are we're only going to go till about 4 p.m., which will be 10 p.m. your time. And in Mexico, are you guys on Central Time, Daniela, or are you on Eastern?
Central.
Okay, so you guys are just an hour back here. You're at 12 to 4. Yeah. Okay. Gotcha. So we understand that things happen. So we're going to have a makeup day. If we feel we're going to have these recorded. So if we feel that the recording would be good enough for the makeup day, we're going to ask you to watch that and take the quiz for that day. But we also will have some kind of makeup class that gets all of your questions answered and everything. That may not be on that following Wednesday. And I'll tell you why. We had to push this all 1 week forward. And my daughter is going to have a baby and her shower is that week, which would be a week from here. So, and that's also here in the United States, it's Labor Day. So we'll just keep in touch with you on that makeup class if we need it. Okay. We're not going to have more than 6 people, so you'll get individual attention.
Okay.
You'll get your questions answered. You'll be able to talk. Okay. How does everybody feel about that?
Yeah, great. And so next week it will start. So we have 4 attendees now.
Okay.
So it's not a question if we're going to do it next week. We are going to do it next week.
We are. We're doing it. It's happening.
Okay, great. Yeah.
It's happening. So before we say goodbye, I just wanted to run over a couple of things with you guys, okay?
Okay.
Let's just kind of play a little game here. It's called What's Wrong with This Picture, okay?
Okay.
Or what could you have done differently to make this a better image? So let's start with Daniela. What could you have done to make this a better image?
Maybe click one at a time, Kristen,
Yeah,
because it's very small.
Oh, you can't see
Yeah.
it. Hang
It's
on.
very small.
I can't.
Hang on. Hang on. I can do it differently. Let me stop share.
Yeah, we see all the images.
Okay, I got you. Hang on. I know how to do this. Just give me a second. Any questions while I'm doing this craziness?
Well, we were talking about the colors, frame, the images, and positions, all of that, but are we going to learn something about the interpretation? Or,
yes.
Yeah, okay.
Dr. Carol Chandler, who is probably the #1 thermologist in the world, is going to be doing an entire section on how thermologists, because our interpreting physicians are called thermologists. So how thermologists interpret, what they're looking for, and specifically how they do it with our software, which is the total vision interpretation software, but how they do it and what they need to see from us and why it's so important that we follow the rules. So it's going to be, it'll be by Dr. Carol herself. It's not me.
Wow. Wow.
It's not me like,
Amazing.
this is what Dr. Carol said. It won't be that. It's going to be her.
Wonderful.
Great.
Yeah.
Yeah, that's a treat. Wow.
Yeah. Yep. All right. Now let me find this. I had it. I had it. Now I got to go find it again. It went away. Let me see here. Aha. All right. Let me see if I can get a couple of these up. Okay. Now tell me if you can see this. It's going to be a little small, but can you see it better?
Yes. Yeah.
Okay. So look closely. Daniela, what would you have done to make this image better for the interpreting physician? There's a couple of things you could have done. So just give me one.
Well, there's
It's out of the overlay.
yeah, that I missed that word.
It's not centered.
Good. Okay, so what we're seeing here is we're seeing the overlay here. And what do we see here?
Yeah, it's out of it. It's not
Out of frame?
She's underfilling the overlay.
Underfilling. Okay.
Okay. So what would you have done to fix that? There's a couple of things you could have done.
Well,
Zoom
in.
Good.
If it's underfilling the overlay, we can zoom in.
Good. Good. Monique, what would you have done?
I didn't understand. I didn't hear what they are saying.
They said that this person is underfilling the overlay and they would have zoomed in.
Yeah, zoomed in.
Zoomed in.
The eyes. You have to
good.
Measure, or not measure, but the white spots between in the eyes. So for the temperature.
Okay, so are you saying that you would change the temperature on this?
Yes.
What would you change it to? What would you have done? Make it
hotter?
White
in it.
More white. Okay, all right. We'll talk about that later.
Okay.
What would you have done, Daniela, with the temperature?
I think it's a lot of fuzzy yellow.
Fuzzy yellow.
I would have changed that.
Ah, where did you get that term fuzzy yellow?
From you.
I know, fuzzy yellow. Okay, good. Okay. I have a big issue with fuzzy yellow. I always try to get rid of it to isolate the pattern.
Yeah.
And also to try to retain what we see down here, because she's really split in half, isn't she? She's very hot up here. Mm-hmm. So maybe sinus. We're not allowed to diagnose, right? But that looks pretty sinusy to me. And down here, she's really cool. Cool cheeks, cool nose. So you end up with what we call, and it's going to be a new term, color negotiation. Color negotiation. You're negotiating between the top heat and the rest of the face, which is cool. And you're kind of balancing it and you're negotiating between the two. And then you may have to negotiate the laterals, right? Too, because the laterals might be really hot or really cold in intensity. So we're going to talk a lot about color negotiation between sides, because these all have to match up, don't they? We can't just do one and then change the color on the laterals, can we?
No.
Okay. Now, Francine, what else would you have done to this picture? We've zoomed in, we've adjusted the color. What else would you have done?
I think I would have asked her to sit up straight, maybe, or.
Good catch. What does it look like she's doing?
It looks like she's leaning forward.
Right. Right.
So have her sit straight up, or.
And her arms.
And also do something
yeah.
with the arms. Is she hanging down her arms, or is she putting it on her hips, or what is she doing with her hands?
Right.
So, also very important. I think I always say to my clients, keep your eyes open, close the mouth, and don't smile.
Perfect. Perfect. Okay, good. So there's a lot that could have been done here. I would also argue, although this could be a very narrow shouldered person, I would also argue, look at my shoulders here. And my arms are up against the side of my body.
Okay. Yeah.
And so you tend to not fill those shoulders up very well. So when you bring your elbows out and relax your shoulders, you'll fill this in. But what do you have to do first?
You have to move forward. You have to move forward, or at least we move to stand forward, that we can zoom in, or ask the patient to come forward. Okay, so let's start from the beginning. We changed our color, we negotiated, and I think, to be honest with you, I think this is pretty good negotiation. I would, though, like Daniela said, knock it down one and get rid of some of this yellow. I would try to get rid of it without making it look too cold here. Number one, that's color. Frame, it's too low. I wouldn't zoom in until I got the frame in the right place. I need this nose to be over her actual nose. I need this mouth to be a little higher, because if you go ahead and zoom in without actually centering her in there, you might over zoom just not knowing, right? So you got to lift this up a little bit. The eyes, this is the eye overlay, and this is her actual eye. This is the nose overlay, and this is her actual nose. So you've got to lift this overlay up, then zoom in. Once you do that, this is a little bit more over her shoulders, right? And if you have her get those shoulders out and relax them a little bit, they may just fit better in here, maybe. Yeah. And one of the most important things I think that a lot of people don't do is they don't pop that overlay off and just get an idea of where they are. They'll let that overlay fool them into thinking that's the actual nose. Oh. Right? And you pop the overlay off and go, oh, wow. And also the other thing is that overlay will fool you when the head is slightly turned. That overlay can fool you. You take the overlay off. Oh, her head is turned. How did I miss that? Because the overlay made it look right. Yeah. Okay. Yeah. And one more question about this. So let's say this is a woman's health study. We've got these shoulders up here now. Let's say we lifted this all up and zoomed it in, and the shoulders got better. Shoulders don't always get better, but in this one I think could. What is the downfall of having her shoulders down like that, considering the imaging study that you're doing? I don't know. I'm not sure what I... Okay. All right, so you're doing a woman's health study. So what's coming down the line? What's coming down the line if you're doing the head and the neck and the chest and the breasts? Yeah. Trunk. So if her arms are alongside her body and not out, her elbows aren't out, what have we just done? Oh, you're creating differences between one and the other imaging. I mean, it's hot underneath her arms. You're not airing them out. Oh yeah. Oh, so when you start with the head and you have them airing out with their elbows out, starting right with the head, by the time you get to the breasts, you don't have big white hot spots underneath the arms. If they're crunching over like this, their breasts are hanging on their upper abdomen. Yes. Right? They're touching the upper abdomen. Now you got a big white hot spot there. You're not giving them the best imaging you can if you don't remind them to keep their elbows out, starting right from the head. Okay. Because this, for even a minute or so, doesn't do the trick, does it? You know
you got to keep those elbows out and start that airflow underneath the arms right from the head if you're going to get a good breast farther down the line. So I tell them that. I say, hey, I know it, you know, I'm asking you to keep your elbows out. Just make sure they're comfortable on your lap and just keep those elbows out because your breast is coming down the lane. We're going to be in about 5 minutes. We're going to be doing your breasts. And you might have to do this for 10 minutes to cool off. But if you start now, you've only got a couple minutes to cool off this way. Oh, okay. I said, your arms will get tired if you do have to do it too long. Okay, thank you. And then I just give them gentle reminders. Oh, don't forget, keep your elbows out because you'll see when they start to get hunched. You'll see it.
That's right.
Okay. So there was a lot to unpack on this one picture, wasn't there?
Is it? Yeah, it's another question, Kristen.
Yeah.
So if you have them with the elbows out, would you be able to see a dropped shoulder?
Yeah.
Oh, okay.
You usually can.
Okay.
And you know where you're going to see the drop shoulder really well is the upper back and the neck. You'll start to see the slope on the neck. And then by the time you get to the upper back, you'll see it beautifully. But yeah, you can see a little drop right here, can't you?
Yes, that's right. Yeah.
Yeah. And when those elbows are out, that's the same ratio. So you'll still see.
Oh yeah, of course, because it's bilateral. Yeah, of course.
Yeah. Yeah, but that's great. And sometimes, you know, we're going to talk about taking extra images as well. And I think that's important because sometimes you need to give the doctor an extra image. And that's you using your own intuition saying, you know what? I'm going to take an extra image here. I think it'll really help the interpreting physician get a better look at this. And what's the really big rule about taking extra images? Let's take an example of the hands. You think you need to take an extra image of the right hand. What's the big rule about that? Big rule.
Left hand.
Let's take both hands.
You take them both. The right.
Right. Good job, thermographers. Always take the contralateral image. Always. You can't just give them one hand and expect them to figure out what's going on. You got to make sure that you give them something because it's all about what? Starts with an A. It's all about
asymmetry.
Asymmetry. Woohoo! All right. This has been our little session here to help you guys understand. Are you ready to start next Wednesday?
Oh, sure.
Yes.
I promise I'll keep it interesting and fun.
Well, very nice.
So next Wednesday we start.
Yes.
Next
11th.
Wednesday, same time. And it'll be the same exact channel here, but I'll send out the Zoom link again, but it'll be the same Zoom link. Okay. We're recording all these for your benefit. And
de tekst.
De training?
Nee, dus dat we de blaadjes of de dingen die we nou zien, de PowerPoint, krijgen we die ook, zeg maar. Hè? Dus de foto's. The pictures you're showing us,
asking
if she,
on. Yeah.
Are you sending them to us?
The PowerPoint.
Oh, am I going to send you, first of all, I'm going to send you this recording here. So you'll have this recording. And then when we are training, I'm going to send you that recording as well. But I'm not going to send you the PowerPoints because those are my and Carol's proprietary PowerPoints. But you'll see them. They'll be right there recorded.
Yeah.
All right.
So you'll have them. You'll have them. And I might even send you some study sheets too.
Yeah,
I'm
that's
working
what
on
I mean.
sheets. Yeah.
That's what I mean. So you have you can remember it. You can
right.
Yeah.
And the other thing I want you to know too is that with this training comes all kinds of goodies. I call them goodies from me. I have so many documents and things that you can send your clients. And I just, I ran my own business for many, many years. I worked for Carol for many years and I did my own for many years. I have so many documents and so many things. I'm just going to send them to you. And they're going to be in Word so you can change them up. And they're nice little bonuses. So
nice. Thank you so much.
Great.
Yeah.
You bet. Okay. Thank you. We've just come upon our hour. You guys are great. I look forward to seeing you next week. and I'll send you the link, the shareable link for this particular little mini training we did today.
One more question. Who will be the first to do the live imaging?
I was going to send out like a sign-up sheet to you all.
Okay.
I'm waiting for the other people too that we're going to have do it. And I hope they watch this.
Yes. Yeah.
And it's the next, it is the 11th of August, and then
Right.
A week later and a week later?
Yes.
Right. Every Wednesday from Eastern time, 1 to
10.
4 or 5, which is 10, about 10 your time. Yeah.
Okay.
You guys are going to be tired. I'm going to be like, hey, everybody. And so we'll read the room.
You have to work.
Yeah.
Wake up.
Yeah. Let's go to work.
Get some coffee and get going.
Nice.
All
Very
right.
nice.
You guys are great. I'm looking forward to it. We're all going to have a great time. We're going to learn together. And I think we're all going to come out of it feeling like we really did something special here.
Absolutely.
Nice.
Thank you so much, Kristen.
Yeah, thank you very much.
Thank you. Nice to meet you.
Nice
See
to
you
meet
next week.
Bye.
Bye-bye. Nice evening.